My name is Ameh. I'm the founder and the president of the Mandate Health Empowerment Initiative, MHEI, and also the convener of the African Mental Health Reforms Consortium, Ameh. We actually do on two things. So the first thing is on mental health, and then also drug prevention and care. For mental health, two things are very pertinent for us at Mandate Health Empowerment Initiative. The first is mental health reforms, right? And then the second is community mental health care. So for mental health reforms, we are very, very interested in knowing and seeing that a nation like ours, a nation like Nigeria, do not trivialize, do not take, without act of prioritization or seriousness, the issue relating to mental health reforms. And for us, mental health reform simply means mental health legislation, mental health policies, mental health plans. So when these three are in place, for us, we feel we are fulfilling our mandate. And the second area for the mental health is mental health community care. Very interested in driving community mental health care. So whether it be access to mental health care, whether it be, the availability or the cost of mental health care to the average Nigerian, to the Nigerian at the rural or at the grassroots, it's very important to us. So I will say categorically, without mixing words, that mental health is not only limited to those in the four walls of the psychiatric facilities. It will interest you to also know that we have depth of statistics in Nigeria. There have been very low surveys or research, on the subject matter of mental health in Nigeria. Okay, thanks to WHO and also some other institutions here and there that are coming up with some form of research works. But then, over time, it's been seen that the causative factor of mental illnesses or mental disorders in our dear country, Nigeria, has to do with issues like drug misuse, drug substance misuse, and also poverty. I must say that, you see, the passage of the mental health bill, which has been a very strong campaign that have been on ground for the past couple of years, it's a very good plus. We sincerely appreciate all the actors that have been involved, from the Federal Minister of Health to WHO to Christian Blind Mission, CBM, and to other local mental health NGOs in the country. So it's not just about the Mandate Health Empowerment Initiative. I remember that in 2017, we began an aggressive campaign, an aggressive advocacy for the repeal of the 1958 Lunacy Act. And I can guarantee you, I can assure you that this didn't really come down easy with us. We've suffered a lot of criticisms. We've suffered a lot of setbacks. We've suffered so many pitfalls. But I want to say today that the passage of this bill that's gone through the third reading and has moved from the red chambers to the green chambers, it's a very huge plus. It's a very good one, because I without mixing words, I can't overemphasize on the importance of it, but I can just run through some few. The passage of this bill, repealing the 1958 Lunacy Act in this country, Nigeria, will help provide a legal framework to regulate mental health and substance abuse service delivery. 2, it will help enhance a formidable front for all of the lapses and the lacunas and the gaps we see in the mental health service delivery across the nation. Three, this repeal of this particular Lunacy Act of 1958 will help protect the rights and the freedoms of those persons living or who have come down with mental health disorders or who are having to experience drug or substance misuse disorders. Four, this particular Lunacy Act that has been repealed graciously by the 9th National Assembly will help to provide an enhanced quality of life for not only those at the rural areas, but also those at the urban settings. It will help improve the quality of life by ensuring that Nigerians have access to well-equipped, integrated mental health service delivery. This is what we are calling for. This is what we have seen there is a gap in Nigeria, especially as it concerns the mental health service delivery across the nation. So this particular Lunacy Act that has been repealed is not something that will just serve at the national. It's not just something that will serve at the state level, but also at the primary healthcare level, which has been our cry, which has been our area of focus, because those at the primary healthcare level deserve quality life, deserve to lead a quality life, and it begins with ensuring that mental health is cared for. All of these things that I've mentioned that this repealed bill will be serving is a huge gap in the old law, okay? The old law does not in any way match with the realities of the mental health challenges that we have presently. Globally, across the globe right now, there are trends of issues arising from either pandemics, either socioeconomic issues, either from insecurity. There are so many issues that are coming up now, breeding all sorts of mental or psychological disorders. And until we have a national framework or a national act or a law that will support and provide plans and provide policies, there have to be policies on ground. And we have to have not just plans and policies, we need to have legislations that will back up, okay, the implementation of this act across the nation. Okay? So we're not condemning in totality the 1958 lunacy, but we're saying it does not match up with the realities of today's mental health world. Mandate Health Empowerment Initiative, talking about how we began our engagements, advocating, lobbying, and getting involved, with other critical stakeholders, for this particular repeal of the 1958 Lunacy Act, have been very wonderful. It's a story that we can't tell in a hurry, because there are so many things that happened that we can't forget in a hurry because of how painful they were. So many institutions and so many persons also misunderstood our stand and our position for the drive for the repeal of this Lunacy Act. And some of our engagements were also challenged, not only even misunderstood, but thankfully, I can guarantee you that today we're on the same page. I want to also have you understand that the journey through the advocacy, the lobbying, and the engagement, for this mental health bill have not just been a call for the Mandate Health Empowerment Initiative alone. I want to thankfully appreciate the Federal Minister of Health, Mental Health Action Group Committee from the Federal Minister of Health, the CBN, the WHO, Nigeria. They have immensely contributed to helping the advocacy and all other engagement, to work out well. Thankfully, my very beloved mentor, Professor Guruji Oye, who is the chairman of this action committee for mental health from the Federal Ministry of Health. Couple of meetings here and there, couple of engagement, like two remarkable ones that I will just quickly have to mention. The meeting at the Chelsea Hotel in 2017, and also the meeting in 2019. A lot of stakeholders were involved. The Association of Psychiatrists of Nigeria, led by Professor Taiwo Sheikh, fantastic, amazing association, the Clinical Psychologists Association, because we were hoping that all of this was going to happen at the 8th National Assembly. But I mean, having passed the first and second reading at the Senate floor, it ended, because I mean, the 8th Assembly tenure was ended. But I want to say here that it's painful to see that some critical stakeholders, did not see the need or the urgency for prioritizing mental health in their country, Nigeria. And like you might be aware, in every 40 seconds, someone somewhere out there is dying of suicide. Over 327 million people globally are suffering from depression, clinical diagnosed depression. These are cases that are very, very, 1 out of 4 Nigerians have been said to surely experience mental health crisis in their lifetime. These are issues that cause for concerns and prioritization of mental health. Are we talking about the out-of-pocket payment? Are we talking about the budgetary allocation for mental health bill? These are all very concerned issues, in our dear country, Nigeria, that we are hoping the passage, of this bill or the repeal of this Lunacy Act of 1958 will help, to resolve. It's not just about the Mandated Empowerment Initiative. The likes of Gede Foundation, the likes of NIM Foundation, the likes of Secure the Future, the likes of a couple of associations, have been involved in these. About 25 of them, and all the 25 of them were also, when the public hearing came up in February 17th. All of these, we came together and we came up with a memorandum, and it was submitted. So it's something that I would like to say that a couple of local NGOs are very much involved. In as much as we never got a donation, a single dime donation for all of this engagement. We've never been funded for any of our mental health activities. We've never been funded for any mental health engagement. But I can tell you that all of these self-funded activities is yielding. And all of these actors that came together contributed their ideas and their technical know-how to ensuring that we got to where we are today on the subject matter of mental health bill in Nigeria. The biggest success, I think it should be on this subject matter that we're discussing right now, because like I mentioned earlier, mental health reforms is the crux of the matter for us, is our thematic core area. We really want to see a country as Nigeria having mental health plans, having mental health policies, having mental health legislation, because we believe that the journey into a healthy Nigeria begins with mental health. So if we have Nigerians mentally healthy, then it's a great success for us. Yeah, one of the things, among several other advice I would like to give NGOs, local NGOs, as a matter of fact, who are also engaging in advocacy work, is please just stay focused. Try to really understand what you're advocating for and stay on it. Build relationship around related stakeholders, who are also on the same subject matter. Build a very good relationship with them and see how you can co-opt them into supporting your advocacy, into involving in your advocacy. Please remember, it's not just about your organization. It's not just about you. It's about the country as a whole, at large. Can mental health problems be avoided? Okay, so I'm going to answer this a yes and a no. Yes, because if you look at the causative factors of mental disorders or mental illnesses or mental health problems, okay, there are some of them that, yes, we could mitigate. There are some of them that we could avoid. There are some of them we could work and provide or cushion or come up with coping mechanisms to push aside. But again, because we understand that mental illnesses, okay, there are some categories of mental illnesses that are biological. So this set of, or this kind of mental health problems, we can't avoid them. We can't push them off, okay? We can only counsel, we can only guide, we can only provide, there can only be provision of health counsel, to try to cut, to try to prevent this kind of disorders from happening. But to say it should be totally avoided or totally cut off, this might not work well, especially for the biological causative factor of mental health illnesses in Nigeria. But for the likes of the ones that are caused by poverty, the likes of the ones that are caused by insecurity, like we have currently in this country, the issue of insecurity have breeded a lot of anxiety disorders, have slumped people into depression, have taken people into a psychological state that they can no longer fit into their normal or regular functioning at workplace. So this kind can be avoided. The likes that are being breeded by drug substance misuse can be avoided. What Nigerians can do to protect their mental well-being, for me, the first thing will be knowledge. Okay, will be knowledge. Please open yourself to accepting new knowledge about mental health. There's so much misconception out there. There's so many myths out there around mental health. People believe that mental health should not be discussed. People believe that when you come down with mental health or when your families come down with mental health, you should be an outcast. You should not associate. You should not be found in the public. You should not be found taking up responsibilities or roles at workplaces. This is not correct. One of the things I would like to advise or admonish in trying to look out for mental well-being, you need to understand, first of all, what exactly is mental health. What exactly is mental, because it's not just people who are eating from the waste bin. It's not about people who come down with psychosis or maybe schizophrenia and they are putting on rags. No, it's not just about that. It's about you. Mental well-being is first of all about you listening to me right now, realizing your ability and potential. It's about you developing coping mechanism to deal with daily normal stress. It's about you being productive. It's about you finding reasons to contribute to your community, to your society. So beyond just knowing about mental health, again, I will admonish, the same way we care for our physical health, please begin to consciously care for your mental health. There's nothing wrong with going for mental health assessment. And when you need help, please don't hesitate. Do not hesitate. Because all of the things we are seeing across Nigeria in terms of suicide, in terms of people coming down with depressive conditions, it didn't just jump on them. It begins from mild to moderate. When it's not managed, when it's not treated, it goes to severe. So do not wait until it's now moderate or you're now struggling to manage your mental health and the reality of life when it's already severe. No. When you sense any symptom, any of the signs of these mental illnesses, please seek out for help.